theory is the earliest explanation of how one adjusts to aging. Within this theory, age and gender are interconnected as they imply roles in our society. According to B.J. Biddle, role theory is one of the most popular ideas in social science. Role theory was created and proposed by George Simmel, George Herbert Mead, Ralph Linton, and Jacob Marino, but they all differed on the way they defined role. According to Toohey and Jett, human behavior and roles are guided by expectations of one's self and as well as the people's expectations in society. Our presentation will demonstrate role theory in terms of age as we infantilize the older adult and limit their capabilities due to their assumptions about their age, and it will also demonstrate gender roles. While watching our skit, remember these stereotypical assumptions about roles are dated back to the early 1900s.
Kelton Sundstrom, we're ready for you.
Okay.
Where's your walker?
I don't have one.
Oh, okay, so you need a wheelchair. Let me go get one for you.
No, I don't need one.
Stop. The assumption that the nurse made that Kelton needed assistance walking proves the stereotypes in society that older adults are often weak and need help with ambulation.
Hello, how are you two doing today?
Good. Are you the nurse?
No, actually I'm your doctor.
Oh, are you Dr. Logan Lewis?
Yep, that's me.
Oh, we were expecting a male doctor.
Oh, that's that's what I get all the time.
I was kind of hoping for a male doctor.
Stop. The generation that Kelton grew up in caused him to have the assumption that all doctors are males and nurses are females. Due to this, he feels more comfortable with a male doctor.
So the results from your colonoscopy came back. Unfortunately, it looks like you have stage 4 cancer. There's multiple options as far as the treatment plan goes, but it will be extensive.
Who's supposed to take care of the family?
Looks like I'm gonna have to start making some money.
Well, you're supposed to take care of the grandkids.
And the farm. Who's gonna take care of the farm?
I think we should sit down and talk more about your concerns.
Stop. Now that Kelton is assuming he will be unable to provide for his family, he tells his wife that she will need to assume more responsibility regarding finances, which means she is stepping into a new role that is often typically seen as the male's role in the family. According to our textbook, role transitions that occur later in life include retirement, grandparenthood, widowhood, and becoming a caregiver or a recipient of care. The most difficult transitions are the ones that include loss rather than gains, especially transitioning from a state of independence to dependence and becoming a recipient of care.
Within role theory, there are many different roles that an individual may assume throughout their lives.
In the previous skits, we touched on age, gender, and caregiver roles that may be seen in society. Now to Tina and Sierra to talk about nursing interventions and strengths and weaknesses surrounding role theory.
Role theory implicates nursing interventions. The first nursing intervention our group came up with is active listening. Role theory demonstrates and enforces active listening because roles are constantly changing, so we need to listen to our patients as they describe their individualized, specific needs. The second nursing intervention we found applicable to role theory was promoting self-care. Promoting self-care avoids limiting patients, such as the elderly, due to their age. It also avoids falling into a stereotypical role by promoting independence and confidence. The last nursing intervention we chose is pain control because it is important to understand pain is not acceptable for people fulfilling the roles of older adults. Pain is not a normal process of aging, and it is important to inform our elderly population of that.
A strength of this theory is that it stops assumptions that older adults are cognitively impaired if they take longer to answer a question, that they need a wheelchair or other ambulation device to get around, and that they are weak or frail. Another strength is that it gives a baseline for anatomical assessments for both male and female patients, such as assessing bone density and continuing baseline screenings. A limitation of this theory is that society is always changing. So as nurses, we need to be able to adapt to these changes and remember that both men and women are engaging in behaviors that were unimaginable when the role theory was created. Another limitation is that role theory can't explain how the role expectations came to be or what they are.